Good morning, everyone, and thank you very much to all the organizing committee, to Laura San Pietro, and to all that invited me to present today with you. I hope this information will be valuable for you. Okay, what I will present today is really our challenges and how the trends in the 21st century will bring how to face HTAI and how to have HTAI as a promotion to help solve some of these problems that we face now. First of all, the challenges that we have. We have health gaps by income countries. It is really incredible to see. Let me see if I can find the. Okay, well, the challenges, the health gaps by income country. What you have in red is really what happens in low-income countries. Well, you can barely see. But this is maternal mortality, for example, in low-income countries is 650 per 100,000 live births, where in high-income countries just 9. So these are really health gaps that we have life expectancy at birth or under 5 mortality, 126 against just 7 in high-income country. So there are really very high gaps between the different income countries. We have, of course, the non-communicable diseases that has been addressed already. So we have 4 major diseases, diabetes, cardiovascular, respiratory, and cancer. And when we look around, we see that there are some countries that, for example, at least 7 countries do not have any mammograph equipment. How are they going to screen breast cancer? So there are really things that we really need to pay attention. There are 25 countries lack of any type of radiotherapy equipment. How are they going to radiate their cancer patients? If we go then, we have to take care of prevention, diagnostics and screening, treatment and rehabilitation. A lot has been written about essential medicines. Okay, that's fine, the medicines, but first you need to diagnose the patient. With what? With a stethoscope. Let's start with the very basic. You need medical devices everywhere, for every clinical practice that you do. So you need a stethoscope, you need early diagnostics. So if you do early diagnosis, then you can save lives. And if you do late diagnosis, this will lead to complications in the patient, but also cost rises and then economic and social impact, bad impact, because we didn't really diagnose on time something. So that's why we need medical devices. Medical devices, there are more than 10,000 types of medical devices. There are 1.5 million types of generic medical devices. So it is very complex. It goes from a stethoscope through a nuclear magnetic resonance to an IV pump to syringes to all kinds of things that you see. So the other big challenge that we have, the Millennium Development Goals. A lot was said, and we still are very, very far from achieving them. So now, what do we need to do? Well, let's just innovate. But innovate doesn't just mean having a new piece of medical equipment. That's not just innovation. Innovation is also on the logistics. How can we make sure that that device arrives to the place on time? That we have sphygmomanometers that work, to have maintenance, to have really procurement. So we have to innovate in the financing. How are we going to pay for the devices that people need? On leadership, there has to be health technology assessment, health technology programs all around the world to really make the technologies arrive to where they're needed. We need to be accountable for what we do. All of you that are here, in one way or other, they're leaders. They're in academics or in health systems or so. We are, all of us, because we have the knowledge, we are accountable that we need to really make things happen in the health sector. We need to make the delivery of health really get through. So we need the devices, we need the medicines, we need the human resources, the financing, everything. And of course, a lot has been said about point-of-care technologies. That is really, we need to bring the technologies to where the patient is, because we always want, there is a big hospital here with big technology, let's bring the patients here. Yeah, but there are patients that cannot really afford to go there. They have to travel many hours, they don't have the funds, they don't have the money. We need to go and look for them and solve their problems in their place of origin, to have point-of-care technology to really be able to solve their problems right there. care. And this is really what happens in maternal health. We still have a lot of women that are dying just by giving birth, and that is totally unacceptable. Newborn care, child care, there's still a lot dying less than 5 years old, and that is unacceptable in a society where we have so many advances, technological advances and economical advances and all these things. If we cannot really achieve the very basic things that is maternal health and neonatal, then we're very far from reaching really a good society. We have infectious diseases like TB, HIV, malaria. We're targeting them. So we really need innovation for that. This is what we have. We have lack of specialized human resources. Why? Because once he gets trained, then he wants to go to another place where he can have a school for his children and a better place to live. So they leave the rural areas and they go to the cities. And then who's taking care of the people in the rural areas? So that is really a big concern. Then another one, it's the dispersed population. There are still some people living in the mountains or places where they cannot be reached easily. They are lacking appropriate hospital infrastructure. This is what we see, and this is also inappropriate. It cannot be like that. There's long waiting times, so the technology sometimes is there, but maybe they close at 3 o'clock and they close for the weekend, so people have to come back. Or sometimes when the patient is being diagnosed cancer and she goes to the radiotherapy equipment, they say, well, it's not working today, it's broken, come later. How can you tell a woman, come later, if something is really broken? We really need to focus on that and make sure we have the medicines, the technology, the human resources available for all those that need. So what we need is, we did a survey and tried to find out what's happening. Is there any health technologies policies around the world? And we just found that just 34% of the countries have a health technology policy. And here, all these maps are in the website, in WHO website. If you look under medical devices, you can find all of this information. Then we find, for example, that just 29% of countries have a national list of approved medical devices for procurement or reimbursement. That means all the other countries, how are they going to do the reimbursements? Do they have a list that they approve by regulatory agencies and then health technology agencies? No, they don't. So how is the products purchased? Then 74% of 135 countries have at least a health technology unit. Maybe it's just one person, but that person can make a difference. So let's work for health technology units. Then we need to have more regulations on medical devices, on medicines, on clinical procedures. We need to regulate them better. There is still a lot of countries that a lot of bad products arrive to their countries. They're not safe and they make patients die. So we really need to target that. And finally, there are some countries that carry out procurement, and we need to have better sources of guidelines for procurement. Which are the trends for 2030? You have been seeing, because this has been addressed by all of my previous speakers, that really the cerebrovascular diseases, ischemic, cancers, road traffic accidents, those are the ones that will be growing. This last line is 2030. So this is really the target, and hopefully the infectious diseases will be slowing down. We're also getting old. We're all getting old, and the pyramid is getting that way. We have the pensions problem. There is not enough money, so we really need to do something to keep our lives healthy, to take care of our own health, and then be able to contain costs. Otherwise, there is no money to get. And then the urbanization and globalization. There's a lot of people that is now moving to the cities. Yeah, but they live in slum areas, like really without any health services, without any running water, without electricity. So it doesn't matter if the people now are in the cities. We still cannot afford to bring really the primary services for them. So on the other hand, we have new technologies development. We have to allocate resources in a rational way. It is really unacceptable that sometimes there are 2 or 3 or 5 nuclear magnetic resonance in a 1 or 10 kilometers area. And then what happens with the rest of the population? How can they reach? No, so we really need to make rational decisions. We have to diminish corruption. There is still a lot of corruption in the procurement, in the industry, in the sales. We have to diminish that. We have to be accountable. We have to be transparent. We have to put the prices on the website so that everybody can see them. We really need to be looking forward for this. We have to find less invasive technologies at the point of care, and we have to use the mobile health, the mHealth and the uHealth and the telemedicine to really reach out for where we cannot. What do we need? The really goal for everything is to reach universal coverage and patient-centered care. And this is really the main concern of the primary health care, to really achieve the universal coverage. Who are the players? Who are the components of the health systems? It's the government, it's the information to make decisions, it's the financing to purchase the services, it's service delivery, human resources, and medicines and technologies. And they all should be focused to people. This is really what we need. And today we're talking about medicines and technologies, but if we don't have the rest of the things, it doesn't matter, it doesn't work. So this is one of the most important graphics that I would like you to see is when moving to universal coverage, we have to cover 3 dimensions. There is not enough money to cover everything. So either we extend to the population, or we extend the services, or we extend the funds. And it is very, very complex to do those kinds of decisions. We have to make priorities, and then we have to say, okay, should we start by the vaccines, by maternal health, and then start growing. But in the countries, there are some countries that decided to give hemodialysis. If you give hemodialysis, then you're giving a lot of population without coverage, because this is very expensive. So you have to keep the balance, and it is really, really difficult. There are ethical and social implications in all of these decisions. So this is really where HTA comes really handy, because this is a tool that can help us make better decisions. So the role of WHO to promote HTA is that we really need to have HTA in every country, and it's really now becoming evident as governments want to make better informed decisions. There is a question for all the health ministries how to reach equity. You've heard about the presentation: sustainability, prioritization, affordability, availability, and accountability. And for all these things, HTA can help. It's a very important tool to help us. The decisions, we had a first global forum on medical devices, because many things were done on medicines but not on the devices. So we gathered 107 countries, and we had 122 recommendations. And out of those, the most important things that came is that we have to have, and maybe you cannot see it, it's right here on the red box, but it's the safe, and then 4 A's. That's available, accessible, appropriate, and affordable. Those are the ways the technology should be: affordable, appropriate, accessible, and available. And of course, safe. And in these recommendations, out of the 122 recommendations, 3 came out of the very first ones on health technology assessment. And these were the recommendations. That is to promote health technology assessment as an integral part of health systems research, and strengthening and assist developing countries conducting health technology assessment. You know who needs more health technology assessment? The poorest countries. The low resources you have, the more you need health technology assessment to make the better decisions. And the ones that have now health technology assessment are really the developed countries. We need to go to the developing countries to put health technology assessment, even simple things to really say how to prioritize. Then help member states to identify tools for prioritizing devices by using the health technology assessment, and promote the value of continuous health technology assessment regarding medical devices, and involve all stakeholders. As Alicia was saying, the industry is very important, the patients are very important, all the health workers are important. We would like to have, and we've been starting already with the Latin American network, which we really congratulate that it's starting. Then in the Eastern Mediterranean, we're starting in Jordan, Iraq, Tunisia, and Egypt. In Africa, with Ghana, South Africa. And we have workshops with more than 10 sub-Saharan countries to really start even the very basic things. In Europe, with the Eastern European countries, and Southeast Asia with countries like Nepal. So we're really looking forward, and we are really, really very helpful that HTAI has helped us achieve this target. For this, WHO has a memorandum of understanding with HTAI, and that was signed in 2010. With INATA, that was signed in Singapore in 2009. With Euroscan 2010 to really help us, find the new and emerging technologies and the best way to target them. All of these are to support a technologies resolution, a WHO technologies resolution, and that is to say help countries assist to make the best selection and use of health technologies, but really according to the needs, not according to the industry, not according to the market, but according to the needs. That is really the main concern. Now we were looking for new and emerging technologies, and this is where Euroscan helped us a lot to find technologies that are really appropriate, that don't need electricity or that can be used in homes or in developing countries on low resource settings. And all this information is for decision makers at different levels. And we're having tools that we have now, and this is all in a CD. I have some for you, but if you go to the website, you can find all of the information that I've been presenting with lots of details about the list of medical devices by clinical facilities, by procedures, and by innovations. And really what we want to do is, and also manuals for HTA, what we really want to have is safe, effective, available, accessible on prevention, diagnostic, treatment and rehabilitation, and provided with quality and worth. Because this is what we want, to have quality and safe health services available and accessible for all the patients here and everywhere. Thank you very much.